For this portion of the exam, you will use hand sanitizer, your gloves, and your first aid kit. All of these items are part of the universal supplies and will already be on your station. Okay, so today we are going to perform the blood exposure procedure. The information that's going to be read is this information here. You will demonstrate the blood exposure procedure. You will imagine the following scenario. During a service, you have sustained a minor cut to your index finger. Pick one. The injury is such that you can continue with the service. Your work area or your client has not been contaminated. You are expected to demonstrate the proper procedure for a blood exposure. You are expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. And of course, these instructions are going to be read another time. They're going to be read twice. And then when they say you may begin, you're going to stop that service, sanitize your hands. And when we are doing if we really cut ourselves, we're washing our hands. At the exam, we use a hand sanitizer. And when we cut our real self, we go in and we we also wash the wound as well. We would normally do it, Nico, with soap and water. Yeah, but because we're at the exam and we're faking it, we're going to act like this is our water. So I'm going to hit the hand sanitizer, and because it tells me to wash my wound when I'm doing the hand washing, I'm just going to do the same thing. I'm just replacing it with my soap and water. Okay?
Like physically doing something, like when they say that, like obviously we're like waiting for them to finish reading the words or whatever. Like how do they know that we literally stopped what we're doing?
Because you're not working. Let me pause this. Well, because you're not working at that time. They're working, and then you don't have to like try to pause. Just that was for me, my acting. Bad acting. That was bad acting. Because you're already gonna be paused. You're gonna already be at a stop.
So
okay.
Just immediately.
Yep. So when they say you may begin, hit that hand sanitizer, wash that wound, take your tools out. I just had my finger out, so it wasn't in there. So when I took my tools out, I just kind of had my finger out, and then I'm gonna get I have my Q-tips inside of a Ziploc bag. And I'm gonna take this guy right here, and I'm gonna put me a little bit of, see if I can get it out so I don't really touch the tip of it. We were able to do it that time, not the first time. Then I'm gonna come in here, put a little bit on that area. You decide which index finger. I'm using my left hand because it's my non-dominant hand, and I work better with my right hand. We are not placing any of our trash on our station. We're just gonna take this guy and throw it in the trash. Now, after I have my wound cared for, I'm gonna wash my hands. At the exam, we're using hand sanitizer. This time, I'm making sure I do not get it on my bandage. And I'm gonna come in here, keeping that same finger out when I take my gloves out. And because I still have to put my tools back in, I'm just gonna hit my hand sanitizer when I'm done. Because I do the most with the hand sanitizer. Just in case I touch something. All right, and I'm gonna put this stuff back in. All right, and I'm finished with the procedure. Every time we stop a procedure, we sanitize our hands and step back. Okay?